Hi there, my name is Mina Alvarado. I'm taking medical physiology at the University of New England, and today I will be presenting an overview of a reproductive system case study that relates to ectopic pregnancy. Today's date is August 1st. Here's a sheet of paper that has my name on it and today's date. Before we take a look at this case study, I'm going to go over a worksheet and infographic that I created that provides an opportunity for us to review the anatomical structures of the female reproductive system. We'll take a look at that. First, we are to label some of the anatomical structures that we see, and then also labeling the structures in the side profile of the pregnant body. And then I will provide the answers to this worksheet in my submission of the portfolio project. Next, we're going to take a look at some of the various phases that make up the uterine and ovarian cycles, and then we will define some of the events that occur at these times. In the first few days of the uterine cycle, menstruation or the period occurs, which is when the uterine lining or the endometrium is shed and exits the body. After the period comes the proliferative phase when the uterine lining is beginning to replenish itself, and until approximately halfway through the cycle when ovulation occurs. During ovulation, an ovum is released from a mature ovarian follicle. And the last half of the uterine cycle is dedicated to the secretory phase, when the uterus is preparing to break itself down to become shed during the next menstrual cycle, as long as pregnancy does not occur. And then we're going to look at the ovarian cycle. So in the first 14 days, we have the follicular phase where a follicle is nourishing several egg cells until one dominates and is released from the follicle after it's completely matured. The ovum is sent down the fallopian tube in order to become fertilized. After ovulation, we have the luteal phase, in which the body is preparing itself for pregnancy. And now here we have a little diagram that shows all of these processes and when they occur, and then also looking at some of the hormones that are involved in the cycles. Okay, so now we will go back to the presentation. So, ectopic pregnancy is also known as extrauterine pregnancy, and this is when a fertilized egg becomes implanted outside of the uterus. In most cases, ectopic pregnancy occurs in the fallopian tube, but it's also possible for a fertilized egg to implant itself in locations such as the ovary and the cervix. There are certain risk factors that increase one's chances of suffering from an extrauterine pregnancy. They include prior history of fallopian tube surgery or pelvic inflammatory disease, endometriosis, and certain sexually transmitted infections. Other factors that might increase the risk include the use of assistive reproductive technology like in vitro fertilization, being 35 years or older, and smoking. And then here we have an image that is depicting an ectopic pregnancy showing the fertilized egg that is implanted outside of the uterus in the fallopian tube. Now we will answer the question of how can fertilization occur outside of the oviduct. So a fertilized egg in an ectopic pregnancy is not viable because it cannot properly develop or survive outside of the uterus without the blood supply that is normally provided there. Ectopic pregnancy occurs because the egg is fertilized before it is fully traveled outside of the fallopian tube. So it's possible that it could just be fertilized before it even has a chance to leave. In some cases of ectopic pregnancy, the egg is fertilized outside of the uterus due to fallopian tube damage or obstruction from trauma, so it gets stuck inside the fallopian tube, and could also be from prior pelvic operations. From having another ectopic pregnancy can increase your risk, and then also from sexually transmitted infections. And then here we see an image that is depicting some of the locations where ectopic pregnancy can occur. It can even occur outside of the uterus, outside of the cervix and the abdomen, which is very dangerous. But we do know that 90% of ectopic pregnancies become implanted in the fallopian tube, so that's the most common place for that to happen. Now we will be looking at some of the hormones that are involved in ectopic pregnancy that can cause complications. Unusually low levels of some of these critical hormones that are involved in pregnancy can result in the ectopic pregnancy. These hormones include progesterone, estrogen, and in particular, human chorionic gonadotropin. These hormone levels can be measured through blood laboratory testing. And then here's an image that explains the normal feedback mechanisms of these hormones on the reproductive system during pregnancy. Now we will answer the question of why ectopic pregnancy is a life-threatening condition. So a pregnancy that occurs in the improper location outside of the uterus is life-threatening to the patient because the fallopian tube can rupture while the fertilized egg is growing in the place where it should not be, where there's not enough space for it to even grow. And so it can cause the fallopian tube to rupture if it continues to grow there. Then extreme abdominal bleeding will most likely occur as a result of this rupture and may result in death without timely surgical intervention to remove the pregnancy. The onset of ectopic pregnancy symptoms are often sudden and severe. So many times people are not aware that their pregnancy is located outside of the womb because it just happens so suddenly. So early detection of an ectopic pregnancy will minimize the complications to the patient. And luckily, we have recent advancements in medical imaging technology. So most of the time, extrauterine pregnancies are detected before these extreme symptoms are even presenting. Now we will look at the treatment of ectopic pregnancy and then some of the consequences of this treatment. One form of non-surgical treatment for an ectopic pregnancy is through injections of the medicine methotrexate. Methotrexate works to destroy ectopic pregnancy tissue, ending the pregnancy by clearing obstructions within the fallopian tube, just causing the pregnancy to end. Some side effects from this treatment include abdominal pain, spotting, light bleeding, nausea, vomiting, and dizziness. Most of the time, there are not very many serious side effects, though. That concludes my analysis of this case study. I hope you found this video informational, and thank you for watching.